Hello, everybody. Just before we begin, I'd like to ask you to imagine a fear that you have that others might consider to be trivial. Now, this could be a fear of heights or a fear of flying. For me, I don't know if you can tell, it's a fear of public speaking. But think about how easy it is for other people to navigate that situation. They just get over it, and how anxiety-inducing it is for you. What if there were a way to immerse yourself into courage? Introducing BraVRy, the solution that lets you confront and conquer your fears and anxiety through the power of virtual reality. My name is Zaid, and I'm the lead VR developer and co-founder here at BraVRy. A quick overview of our presentation is as follows. We'll discuss the problem, our solution, launch into a video demonstration before talking about our market plan. According to a Business Wire survey, 90% of consumers believe that technology will positively impact healthcare in the future. However, only 41% of individuals have ever used technology to manage their personal health. Now, with this in mind, our team wanted to focus on the treatment of anxiety, PTSD, and phobias. These are some of the most prevalently diagnosed conditions around the world, with the World Health Organization estimating that 4% of the global population suffers from these. Now, exposure therapy is pretty much the global gold standard when it comes to treating this, but it can be expensive and difficult to access, in excess of sometimes even $200 per session, USD. Virtual reality exposure therapy has been evaluated by many research studies as an acceptable and sometimes even better alternative in terms of patient outcome, and that's where we come in. So suppose we have a patient struggling with anxiety, PTSD, or phobias triggered by a specific situation. We provide graded and customizable VR simulations that gradually expose them to that scenario. And along the way, we collect bioinformatics to gain insight into the root causes of their anxiety. Our website dashboard provides a convenient place for all of this information to be stored, from where patients can review to understand what their specific anxiety triggers are. And there's also the option to engage with a healthcare professional to foster an individualized treatment plan. All right, now given that virtual reality exposure therapy is considered effective commercially and in research, what sets us apart? We take in a wealth of information from the human body, from the brain, from the heart, from the skin, from the hands, and as well as adding in our cognitive behavioral therapy questionnaire, we really know what's going on with anxiety. All of our simulations come with customizable grades to ease the patient into the therapy. In fact, our demonstration will have 2 such levels. At BraVRy, we believe in therapy on your own time and at your own pace, completely self-led, with the option to engage in cognitive behavioral therapy. These 3 key factors are what set us apart from anyone else in the market. What they try to provide is a one-size-fits-all solution, which doesn't work for therapy. All right, and now time for our video demonstration. So for this demo, we decided to focus on iatrophobia, which is the fear of doctors and medical settings. And as mentioned earlier, level 1 is the first stage, and it's all about interacting with the doctor's office in virtual reality. As you can see, we can pick up this magazine, and when we put it where it needs to go, it checks off a task on our collapsible sidebar over there to track the progress of the user. And as we continue to explore, we see another object in here, this first aid kit, that we need to move to its correct spot as well. And as you can see, it's been checked off on the taskbar. And take a look at that poster right in front of us. You can literally read right off of that. Look how hyper-realistic this is. It doesn't get more immersive than that. And level 2 is all about social interaction. So as we enter the doctor's office, this time we look over to our right and see a few patients lined up. And on our left, we have a very busy receptionist typing away in this pretty crowded clinic. And as we approach the doctor's office on our right, we're free to explore. And as we enter the doctor's office, we see the doctor waving us in with a smile. And remember, all of these events are being tracked. Now over to our website dashboard, as we mentioned earlier, we were tracking all of that information. For this example, we just decided to go for a heart rate monitor due to how accessible they are to a lot of people with smartwatches now. And the key here is at the bottom. There are specific timestamps for when certain events occurred, and we use this to identify what an individual's specific anxiety spikes are. The global mental health software market is significant and continues to grow. As VR becomes more accessible, we expect to contribute significantly to this growth. As mentioned earlier, over 300 million people worldwide suffer from anxiety, phobias, or PTSD. On a positive note, over 171 million people and counting already have access to a VR. This is more accessible than ever before, and it's only going to get more so this way. Our target audience consists of individuals who are looking for new ways to battle their anxiety, PTSD, and phobia, as well as providers looking for something to recommend their patients. For payment, we plan on adhering to a 3-tiered freemium subscription model, with the first 2 tiers intended for individuals and the third tier intended for professionals looking to administer features. As you can see, we have a very multidisciplinary team, which I consider to be our main strength. We're all students. We're a very young company, and I like to think we're quite young individuals, although I may not look it. We worked for the past 6 to 8 months, just completely on our own without pretty much any funding, and I'm incredibly proud. Victory at NatHax 2023 and being featured by the UCalgary social media posts was a massive step in enabling us to understand that what we have is really special. We're very proud of the MVP that I presented here today, but we have so much more we know we can do. We plan on expanding software, hardware in terms of bio-tracking, and we also want to start trials to really address the healthcare burden on a micro and macro level. All of that, and with help from OBI, will lead us to an incredibly successful launch.